Milk ducts actually increase during pregnancy, and you begin to form what we call lactocytes, or milk-producing cells. You have increased blood flow to that area, and I'm sure you probably see when pregnancy that you have all these engorged veins right here, and it looks kind of freaky, but it's actually your body producing and getting prepared for milk production. We actually start forming colostrum in pregnancy. So that's why some women initially, right at the time of birth, they might be like, I have milk come in. That's actually colostrum that your body's been working so hard on during pregnancy. Your actual milk might take somewhere to 3 to 5 days to come in if you're a first-time mom, maybe 1 to 3 if this is a subsequent pregnancy. So now we've talked about all these ducts that are branching in. Milk is an incredibly intricate branching system, the way it forms in the breast. So there's going to be times where you might have a place in the breast where the milk isn't completely extracted well. That could be maybe you were laying on a side, maybe the baby didn't completely finish a feed on one particular moment, maybe you have a tight-fitting bra that put pressure on a particular part of the breast. Many different reasons can really cause you to have a clogged duct. And a clogged duct is very different than mastitis. So mastitis is actually an infection of the breast tissue. So it's normal to feel some breast fullness. You have increased blood flow, milk production, lymphatic drainage in that area. That's normal to feel some breast fullness. But sometimes if you're not adequately transferring or removing that milk, it stays there, and it can actually become something that gets infected. You can have the breast tissue itself can look red, it can look shiny, inflamed, a little tight or taut appearing, just like we mentioned. You can have tenderness there. You might even feel a lump, and the lump might be if there's a clogged duct that really caused the milk to stay there and become inflamed and cause the mastitis. So that's to say you can have a clogged duct that causes mastitis, and you can have a clogged duct that doesn't cause mastitis. Again, women can have fever sometimes with it and flu-like symptoms. And if you do, we recommend calling, your OBGYN, and they can actually prescribe you medication for it. Usually it needs to be treated actually with an antibiotic for the mom so that we can treat the infection that's brewing. Now, when women have a clogged duct, let's say, and they don't have mastitis, there are ways that you can kind of feed around it. So one thing I tell moms is try dangle nursing. Now, this is depending on, your comfort with the baby. So let's say if your clogged duct is on your left breast and it's right up here in their top corner, you can possibly try nursing the baby, and you're laying down next to the baby. Of course, you're likely wide awake, and you're able to sort of put pressure and move that clogged duct and move that milk plug downward, so that you're kind of allowing the baby to suck at the same time, provide that vacuum pressure, and you're also providing counter pressure against it. Another thing to do, a great time to do massage is actually in a shower when you're feeling hot pressure from the water that's coming down from the faucet. You're also able to relax a little bit, and you can kind of massage the duct out there. Sometimes if you are feeling a lot of tenderness and pain there, NSAIDs can help, Motrin can help actually. So let your doctor know, but usually that's just fine to take while you're breastfeeding. And those are some of the top things, but there are ways that you can actually really prevent sort of getting a clogged duct. So one of them would be, I've already hit on it, well-fit maternity bras. So a lot of moms aren't aware that that can actually cause you to have what we call like some minor breast trauma, and that your breasts are so sensitive right after delivery and during the initial breastfeeding period that some small amounts of trauma can really hurt and cause your tissue to get inflamed in that area. Again, frequent nursing, so frequent milk removal will allow less milk to stay there and less chance of infection. Making sure you have an appropriate latch also helps. So even if you're frequently nursing the baby, but the latch isn't great and the baby's not swallowing, then you're probably not having great milk transfer. So having a consultation with a lactation consultant can really help. Moms have the biggest challenge. And I think it's just so much mom guilt and mom shaming that goes on. It's become much more of a public issue, what moms choose to do and how they choose to do it. And it really doesn't need to be anybody else's business. So I think sometimes moms can feel guilt, they can feel shamed over it, whether someone says it out loud or whether they even feel it internally. It's a really sensitive period, especially in the postpartum period, because, just breastfeeding aside, women are going through a huge emotional overhaul. They are now in charge of a human being, which is no longer inside of their body, but now outside of their body, functioning independently, or actually not independently, but dependent entirely on them. They also have to take care of themselves. I think one thing that goes without saying very much is the postpartum period, even physically on a woman, is really hard when it comes to healing. I always say I wish someone had told me, hey, you're not going to be able to walk right for the first couple of days or sit without wincing in pain. Nobody ever told me how hard recovery was going to be, let alone, I knew taking care of a baby was hard, but not being able to move at my same speed and depend on my body to do the things I had gotten used to it doing, that's really difficult. Women are going through issues with their self-image. They may not be able to sleep as well. They may really feel lost in who they are physically, emotionally, mentally, and then to feel additional guilt on top of that. It's really, really hard to kind of come back from that. And one thing I tell women is to have these conversations early on. So if you feel like you're going to be somebody you're somebody who's anxious at baseline and has issues with anxiety in the past, then maybe you should talk to your OBGYN, talk to your psychiatrist early on, that these are issues and concerns that I have. Do I need to be, talking to you? What things do I need to know about early on? Certainly, I think as a pediatrician, I'm really plugged into maternal health because I think it's interesting that, we see our OBs so frequently and then you don't see them for almost 6 weeks after. Now we've sort of changed our guidelines by the American College of OBGYN that they see them about after 2 weeks, but pediatricians see mothers about 3 or 4 times in the first month. So I certainly screen for postpartum depression. Postpartum blues is very common. I experienced it myself. And I think acknowledging those feelings is fine. And it's okay to take help when you can, where you can. You don't need someone to come by and hold a baby. If you actually want them to fill your dishwasher for you and do your laundry, just tell them that. That's totally fine. Do what you need to take care of yourself. And mom guilt will be there. I think that's one thing. I have a great friend of mine who's a neonatal and perinatal mental health specialist. And one thing she and I talked about was, I don't think we'll ever get rid of the mom guilt. I think it's part of us no matter what. But what we can do to help set ourselves up in a healthier way, start in a better way mentally and kind of be more proactive rather than retroactive is probably the best thing that we can kind of do. So if you think breastfeeding is a huge daunting journey for yourself and you haven't even started it, that's okay. You can acknowledge it, bring up your concerns, have a consultation with your pediatrician, with a lactation consultant beforehand. Like I said, kind of like to talk about breastfeeding beforehand. Set down some goals. And if you like to set, smaller goals initially, that's totally fine. Actually, some of the women who I've seen make the biggest breastfeeding strides and nurse for years and years and have wonderful relationships set super small goals in the beginning. And then when they hit that goal, they felt confident enough to move further. So set goals for yourself that you think are doable. And remember, this is going to be a time in your life that's really unlike no other. It won't feel like this forever. And I think that's kind of what motherhood is. Just when you feel comfortable at one point, boom, you're on to something else. And then you're like, I'm not comfortable with this. And as soon as you feel comfortable with that, you're on to another stage. But you will hit your stride. You certainly will. And you're going to feel more confident in yourself more than ever, but you have to take care of yourself. Never put yourself on the back burner. It's one of those things where you have to put your oxygen mask on first before you help others. So make sure you're being proactive about your health as well.